Crisis Stabilization Program for you. Liz.
Hi, so I'm Liz Venuto. I'm a supervisor in our Prenatal to 25 Behavioral Health section, sharing on behalf of Pedro Garcia, the program administrator. Today, I'll be going over the Residential Crisis Stabilization Program, RCSP for short. By the end of the next few minutes, I hope to answer the following questions. What is the RCSP? Who is it for? What does it cost? And what can you expect? And then lastly, the project status and what's next. Next slide. This program is designed to provide 24-hour treatment for children and youth who are experiencing a behavioral health crisis. This crisis may be related to substance use disorder or mental health conditions. The overarching goal of the youth stay in the RCSP facility is to stabilize the youth enough for one of the following: a return to home, discharge to another community setting, or a transition to a higher level of care. Discharge planning begins at the time of admission. And while in the facility, youth receive trauma-informed and evidence-based care that is therapeutic in nature and includes medication management and opportunities for recreational and social activities. There are also opportunities for family therapy and parent-to-parent peer support. In other words, this is meant to be a one-stop shop to meet the needs of young people and their families in crisis. So in this next section, we'll be looking at who it's for, the cost, and what you can expect. So first, who is this program for? The population of focus for the program are young people between the ages of 5 and 17 residing anywhere in the state of Washington, experiencing an active behavioral health crisis. They do not meet admission criteria for inpatient hospitalization or involuntary treatment. And this facility is designed for co-occurring mental health, substance use, and neurodiverse individuals. The RCSP is designed with the intention of inclusion for young people experiencing autism spectrum disorder and individuals with intellectual and developmental disabilities. So in the program cost, we've been legislatively directed to develop up to 2 facilities, one on either side of the Cascade Mountain Range, each with a capacity of 16 beds. So in total, we're looking at having 32 beds available statewide. According to our financial modeling, it's expected to cost about $818 per person per day. With this figure, we can assume it costs, as you can see on the slide, 4.7, I always get tripped up on the numbers, 4.78 million to operate one facility with 16 beds. And we also need to account for startup costs at just over $709,000. The total cost would then be around 5.49 million for the first year and 4.78 million annually after that. The next slide, finally, what specific services can you expect? A full array of services to stabilize the current crisis and to offer support to get a good assessment. So these include things like case management and care coordination, therapeutic activities, medication management, group therapy, individual and family therapy, skilled behavior management, recreation therapy, and educational support. There's also a whole host of medical and behavioral health professionals on-site or contracted to provide as many of these services as possible in one place. As you can see, the range of professionals is broad and designed to meet the diverse needs of individuals and families. So next slide, this project has been under development since 2021, when the legislature allocated $12 million to the Department of Commerce to distribute facility construction grants. However, this is such a new program and it doesn't yet exist in Washington in any form. So after 2 separate requests for proposals for capital funding, we've been unable to attract a service provider that has the necessary expertise and resources to operate this kind of facility. A 3rd request for proposals for capital funding is not planned, and the capital funds are now forfeited. But we're not going to stop there. The legislature also allocated $5.4 million in operational funds for state fiscal year 2024. These funds were allocated to follow the capital dollars to support readiness, program implementation, and operational functions. We're now looking at leveraging operational funding to pursue direct contracting opportunities with one or two capable providers. So at this stage, the Division of Behavioral Health and Recovery subject matter experts have convened to reassess the fiscal model for a pilot program, with a priority of including youth and family voice in the program development. This is a facility that our community is asking for, and we hope to find the right partnerships to truly make it a success. And with that, I will